Hello, welcome back to the Secrets of what you always wanted to know and never dared to ask. This is a series on pelvic girdle complaints. In this third episode, we talk about training. How hard should or could you train someone with pelvic girdle pain? There are a lot of different opinions about how to deal with people with chronic pain complaints. The general idea is that resting is not good. This idea originated from the concept of fear avoidance, the notion that people in pain generally avoid activity and therefore get worse. So the idea is to reactivate. But is this the right way to look at it? In the previous clips, we have already talked about how pelvic patients are often in a vicious circle of impaired control and overload. If you want to break this circle effectively, you will have to reduce the overload. For that, taking moments of rest is very important. But how does it relate to training? There is a lot of discussion about training of chronic pain patients and therefore also for pelvic girdle patients, with roughly two seemingly far-flung positions. The first approach is that of Paul Hodges and his friends, who assume subtle muscle exercise at low levels. In addition, there are the people like Stuart McGill, who believe that for a good physical function you have to train real hard. Which strategy is wise in your pelvic pain patient? It's not a matter of right or wrong. The question is when to do what. Even Hodges' low-level stability training has no effect if there's still too much compensatory muscle tension. So for pelvic patients, make sure you have a good relaxation before you start with the low-level exercises. And realize that these are really only preparatory exercises for basic control. It will not solve the patient's entire pelvic problem. As this clip by Jennifer Kruger and her colleagues beautifully shows, abdominal pressure and consequently pelvic joint compression is very variable. With low pressure you already can do a lot, but for really good function you also need to be able to deliver power at a higher level. The abdominal muscles, and especially the deep transverse abdominal muscle, are essential to press pelvic joints together. This way, you can stiffen and strengthen the pelvic joints when necessary. For this, these abdominal muscles must be able to contract slightly, but also forcefully. Heavy training of the abdominal muscles must be handled carefully and in the right way. When joint compression is not engaged properly, pelvic joints are sensitive to wrenching and may become overloaded, as shown in the upper video. Pelvic pain patients can exercise at higher loads if you keep the sacroiliac joint motions small, more or less isometric in the pelvic region. The lower video is a nice example. It would even be better to keep looking at your hands during motion. Paying attention to quality of performance of the exercises always improves their effect. Yes, this is it again for this time. Hope the info was of use. Next time we'll take a closer look at the possible link between pelvic girdle pain and the side bending of the spine, the scoliosis. See you next time.